There are concerns tonight about women's health care in light of Alabama's new abortion law. Before the developments this week, Alabama was already ranked at the bottom of the list when it comes to women's health care. Thank you for joining us. I'm Naja Sherman.
And I'm Dan Schaefer. Way 31 Stephen Dilsizian learned some fear the new law that bans abortions will push even more doctors out of the state.
Yeah, that's right, guys. Right now, Alabama is at the bottom when it comes to cervical cancer deaths and maternal deaths. Now, that's data coming from the America Health Rankings. And some doctors I talked to earlier today say they're worried that this new Alabama abortion bill could scare other doctors from coming to the state and that these health problems and the lack of care would only become worse.
I think many doctors are not going to want to come here because they will not be allowed to exercise their best judgment and their training.
Nancy Morris lives in Huntsville and says now that Alabama has passed a near total abortion ban, she worries doctors won't want to come to Alabama, a state that desperately needs them.
I believe that women in Alabama are going to struggle to get the health care that they need.
Alabama is already seeing a shortage in doctors focusing on women's health. According to Human Rights Watch, there was a severe shortage and lack of women's specialists throughout the state in 2018, especially in the middle portion of Alabama, called the Black Belt. OBGYN Dr. Willie Parker tells me the shortage is the result of a perfect storm. Doctors would rather work in bigger cities with higher populations. He also pointed to the escalated workload in the field, additional years of studying, and women's preference for female doctors over males. Dr. Parker says now things just got worse.
People who aspire to practice medicine feel threatened either in terms of their livelihood or now with changes in the abortion law.
Under Alabama's new abortion law, a doctor can face up to 99 years in prison for performing an abortion. I asked Dr. Parker if the idea of practicing in a different state has crossed his mind. He shook his head and said the state needs his help.
As someone from here, that if I couldn't make the women and the people of the state a priority, who would?
Now, Alabama is just one of many other southern states experiencing this shortage in OBGYN providers. Georgia and Mississippi also are facing similar problems. Reporting live in Huntsville, Stephen Dilsizian, Way 31 News.